The following is a demonstration of a fingertip revision amputation for a distal transverse amputation. Distal transverse amputations can present with debris and exposed bone at the injury site. To remove debris and prep the injury site for the procedure, soak the fingertip in a dilute betadine solution for several minutes. Ensure gross debris is removed before proceeding. Clean the finger with chlorhexidine or similar and perform a digital block using your anesthetic of choice. There are many options for performing a digital block. Here we can see the web space approach, though your institution may prefer another approach, such as the metacarpal block. Drape the patient's hand and place a tourniquet on the finger before proceeding. Before removing the nail, note the key structures of the nail bed, such as the germinal matrix, eponychium, and dorsal root. Use a freer elevator to elevate the nail from the nail bed, spreading underneath the nail plate and eponychium, working distal to proximal. Apply gentle traction with a hemostat to remove the nail, and, if healthy appearing, save the residual nail for later stenting of the eponychial fold. Before freeing tissue from the exposed bone, note the key underlying structures of the fingertip. Use a freer elevator to free soft tissue from the exposed bone. Utilize both the flat and curved tip of the freer as needed. Next, use a bone rongeur to trim the exposed bone at the injury site. Trim enough bone so the residual soft tissue envelope can create a tension-free closure. To improve cosmesis, create a fishmouth incision by removing small triangular sections on the ulnar and radial sides of the finger. The goal of the fishmouth incision is to allow for the palmar residual tissue to be folded dorsally for a tension-free closure. Ensure that the closure is tensionless before applying simple interrupted sutures. Stent the eponychial fold with the residual nail, if appropriate, and secure to the nail bed. If the residual nail is not viable for stenting, a piece of foil from the suture or Xeroform package may be used instead. Ensure the tourniquet is removed before cleaning and dressing the finger. Learn more and explore our other educational resources by visiting arbutusmedical.com.